Dr. Leana Wen drops by to discuss the coronavirus. It's a fascinating conversation. Check it out. Leave your comments, ding the bell, share it with your friends, and subscribe to our channel. Welcome back. Thom Hartmann here with you. And on the line with us is Dr. Leana Wen. She is an emergency room physician, public health professor at George Washington University School of Medicine. She previously served as the health commissioner for the state of Baltimore. And her Twitter handle is Dr. Leana, Leana Wen, Wen. Dr. Wen, welcome to the program.
Thank you very much, Tom. It's good to be back. And I just wanted to mention that I was the health commissioner for the city of Baltimore, although we like to think of ourselves as a state.
Yeah.
Sometimes.
Thank you. Yeah. My apologies. I used to live right next door.
Right.
It's been a long week. So as an ER physician, as a professor of public health, and, I don't know anybody who would have more expertise at how these things happen. I realize, I don't know if you've been specifically studying this coronavirus, but what's your take on how things that are as transmissible as this virus is or appears to be, given the evidence that we have? What's your take on how this is going to spread? And I'm also curious, we now know that the U.S. had evacuated just a little short of 400 people out of Wuhan, China, Americans, into Japan. And when they got there to Japan after that, 6-8 hour flight, whatever it was, they discovered that 14 of those people were infected with the Wuhan virus. The CDC asked that those people be flown back to America on a separate plane so they could be isolated. The State Department, Mike Pompeo's State Department, and Alex Azar's Department of Health and Human Services overruled that and threw those 14 people in with the other 300 and plus Americans from Wuhan who did not test positive. They were met at Travis Air Force Base in California by CDC people who were wearing protective, spacesuits, and people from the Child and Family Services Division of HHS, the group that have been separating children from their parents at the border. This is their expertise. They're basically social workers. And they were wearing normal street clothes, and they met all these people and then passed out room keys and put pins or ribbons on them to indicate their status and told them where to go stay. And then those people were never tested. One of them got on a commercial airplane, flew someplace. A couple of others have flown to other parts, back to their HHS offices. And apparently several of them live in this community where this woman who's in the hospital right now is I don't know if she's fighting for her life, but her condition has deteriorated so badly they had to move her to a different kind of hospital. Clearly with the Wuhan virus, and she has no contact, although the town she lives in is 10 miles from the Air Force Base where this plane came in. She's had no contact with anybody. That sounds to me like somebody who acquired that, one of these people that Alex Azar flew in there, acquired that virus from some of these, from one of these passengers, and then walked around town, opening doors and things, shedding viruses on them, and then she might have opened the same door to the same store or restaurant or something like that. Am I way out in weird field by thinking that this is what's going on, and there's actually probably hundreds or maybe even thousands of Wuhan virus cases to be found around this Air Force Base, and maybe even all around the country as a result of this decision by Alex Azar at HHS and Mike Pompeo at State not to fly the infected people back in their own separate plane?
So I would like, if it's okay with you, Tom, to begin with the facts of what we know, because in every public health emergency, it's always good that we begin with the science and the facts and understanding that this is a very quickly evolving situation, that COVID-19, which is the new coronavirus, is new, that it was discovered just 2 months ago, and that there is a lot that we know about it now, but also a lot that we don't know about it. What we know about COVID-19 is that it is a respiratory virus. It spreads like the flu, like a cold, from person to person through the respiratory route. So if you cough, you sneeze, and somebody is standing right there, and I know this sounds a little bit gross, but the respiratory droplets land on their mouth, on their nose, then they might contract the virus that way. Also, if you cough onto your hand and then you shake someone else's hand, then they put their hand to their mouth and their nose. That's how they get that as well.
Right, and I understand the average person touches their face 20 times an hour, a habit we all need to break.
That's exactly right. And so there are things that we can do to prevent ourselves from getting the coronavirus, just as we would prevent ourselves from getting the flu or a cold, which is frequent hand washing with warm water and soap, and also staying home and staying away from others who are ill. So that's what we know about the virus. And you were asking about the transmission and the likelihood of transmission. What we understand from the pattern of transmission so far is that this is a very infectious virus, that one person who has coronavirus could transmit it to an average of 2 to 3 other people, which means that it is a contagious illness. Something else that we found about it is that, and this is both good and bad, is that there are people with mild or no symptoms who also have COVID-19, the novel coronavirus. Now, the good thing about it is that it's not nearly as lethal, as deadly as SARS and MERS, which are other types of coronaviruses. It is looking like the fatality rate for this coronavirus is about 2% compared to 10% for SARS or 30 to 40% for MERS. So it's significantly lower. The bad news is that because there are people walking around who may have minimal or no symptoms, they may think they have a cold or they may not have any symptoms at all, but they could still be transmitting this virus to other people, which makes detection challenging. Actually, there was just a case that was reported in California a couple of days ago that's likely to be the first case of community transmission within the U.S., meaning that it's not tied to travel anywhere, at least no known travel anywhere, that it's person-to-person spread within the U.S. And we know that there are more than 47 countries, as of last count, that already have coronavirus being in their countries, and that the spread in the communities in these countries is also happening too. So that's what we know about coronavirus. Now, you referenced a very specific instance, and I want to, again, clarify some details. One is that this coronavirus is believed to have started in a particular place in Wuhan, China. But the World Health Organization is very careful not to call it by the location where it started for fear of stigmatizing the individuals who live in that region, because it's not like the individuals caused the virus. The virus started in that area. It could have started anywhere. And so that's why the name that the World Health Organization has given it is COVID-19, or people are also referring to it as the novel coronavirus. The individuals that you were referring to who were evacuated did not come from Wuhan, China. They were on board a cruise ship.
Oh, thank you for correcting me on that. I've seen news reports that have said both, and so thank you.
And so, I think that's important because, again, we don't, given the amount, as you have reported so much, given the amount of inaccurate information that's out there with conspiracy theories and others, especially for something that's as dire as a public health emergency, I just wanted to clarify that. So these were individuals who were on board the cruise ship, and here's the thing about public health emergencies and any types of emergencies. Officials, public health leaders in general, have to make spur-of-the-moment decisions based on the best information they have available at that time. They are often under extreme time pressure to make a decision one way or another. Hindsight is always 20/20. But in the moment, you do the best that you can, and the best that we can expect from our leaders is that they hear the expert guidance of all those around them, then they make a really tough decision. Now, sometimes with this administration, but with any administration, sometimes you look and you say, that decision was just wrong.
Well, one of the things that we know is that the CDC was so upset that the State Department and HHS decided to commingle these people on the same plane, that they issued an official request that their name not be on any press release about the repatriation of these Americans.
So, Tom, let me first, in my answer right now to you, let me first state that I am not known to be a defender of the Trump administration.
Right.
I have no ties to the Trump administration. I have in previous roles that I've held, I've sued the Trump administration, and so in my stating the following. I am not defending them. I'm just explaining what is my understanding of what could have taken place.
Right. I'm not suggesting that they were malicious. I think they just weren't listening to the science, which seems to be a characteristic of this administration, frankly.
That may be true in general, but I don't think that this is the right example to be using. And here's why. In a situation like this, the decision to evacuate the individuals on the same flight or not is in that gray zone. It is not in the black and white category of this is categorically wrong or categorically right. It is in that gray zone where public health experts will have different opinions about what the right thing to do is.
Okay.
Now, there were other health officials, as I understand, who were part of that discussion, who said they think that it was reasonable, given that these individuals were already on the plane and that they were separated by a whole different area, and there were infectious disease doctors on board. I mean, it's a reasonable decision either way.
Okay.
Now, I do think that there's a lot that the Trump administration has not done right with this response, but I don't think that this is the...
So what about sending social workers to meet them at the Air Force Base with no protective clothing and no training?
I think you were referring to whistleblower complaints that came through yesterday.
Yes.
I don't know the specifics other than what I've read in the news, but certainly it is irresponsible to send frontline workers to be exposed potentially to a virus without protection. As you well said, these are individuals who, I mean, if we can't protect our own healthcare workers, we're really doing disservice to everyone in this country. But also, this is an infectious disease risk too.
Yeah. So bottom line, we're going to hit a break here in a minute and a half. We're talking with Dr. Leana Wen, ER physician, public health professor at George Washington University, previously Baltimore's health commissioner. Dr. Wen, what should we all be doing to prepare for this as individuals and families?
Yeah, so I'm going to say what I wish the president has been telling the American people, because his messaging has been very muddled. But here's what he should have said. He should have said that the risk to the everyday American right now is low. However, things are quickly evolving. This disease has spread to more than 47 countries, and it could well be spread in the form of an outbreak here. He should have said that the U.S. has been leading an effective response so far, but that things are going to get worse because that's the nature of a disease outbreak. Now is not the time to panic. Now is the time for us to prepare, just as we would for any emergency. So bottom line is, coronavirus is now on the verge of a global epidemic. It is in the U.S. It will come to the U.S. Don't fear it and panic but rather prepare. And the best antidote to that fear is the truth. That's what the Trump administration should be doing. They should be giving us the truth. And instead of trying to paint a rosy picture of what's happening, they should be telling us exactly what is happening, what their decisions are, how they're changing their decisions over time based on evolving evidence, and what the American people, all of us, should be doing, because epidemics are an all-hands-on-deck situation.
There are reports of shortages in the pharmaceutical supply line. There's 150 drugs manufactured in China and nowhere else in the world, and apparently they're not getting out of China right now. My doctor gave me a 90-day prescription for the blood pressure medication I take, just in case. The health insurance company refused to pay for it, but I paid for it. But I've told that story. We've got a week or so's worth of food at home, just canned stuff that we're going to use anyway. That seems like reasonable, paper products, things like that. If people freak out, if it comes to my community here in Portland and stores start closing and stuff, as has happened across northern Italy. And I'm telling people to get healthy, stop smoking, start exercising, eat your vegetables. Is that all reasonable stuff?
Absolutely. That's just good health practice and good public health practice.
Okay.